Welcome to the After Hours Clinic with Dr. David Janarious and Better Life co-founder Andrew Lane, where we unpack the science of health and wellness, cut through the noise, and add a healthy dose of humor.
Hello, everyone. It's Dr. Dave Janarious back with another solo recording. I'm here today to talk about a specific screening test that I think does not get enough shine from doctors, from the media, etc. And I think this test is important because we're really in an age where people are demanding to know more about their bodies, right? And there's a whole cottage industry for people that want to know more, right? I won't mention their names, but there are plenty of companies out there that promise early advanced screening for early detection. They promise, 10 million data points they collect on your biometrics. We see the popularity of, I guess, the billionaire celebrity person, Brian Johnson, the guy who looks like an X-Men villain or something, talk about all his, all the biometric data he collects and the supplements he'll sell you so that you can also be younger than your children biologically. And this is all very fascinating. And I'm not here to mock it. I think there's actually utility in a lot of advanced screenings and diagnostics. I use them in my own practice. So I'm not here to in any way disparage, going beyond guidelines and trying to learn more about your body. But one thing I always say is and this is a common refrain in medicine, a test is only as good as what you're going to do with it, right? And that's the reason I don't just shotgun off a standard package at everyone. There are patients for whom I'll order, advanced cancer screen, liquid biopsy. There are patients I will order a full body MRI in, right? But in terms of yield from testing, there's one test that I order that is not ordered by most people's standard primary care doctor that I think has the most impact on my clients. And the brilliance of this test is it is dirt cheap. It's like $80 and is done by a simple blood draw. And that's called the PEth test. So PEth is short for phosphatidyl ethanol. And what that is it is a marker of alcohol use over a period of about 2 to 4 weeks. So when most people think of alcohol detection tests, they think of a breathalyzer or maybe the blood ethanol level they draw in the emergency room. But these are good measures of acute intoxication. But I think what is more important in my setting is what are people's drinking patterns and habits like? If you've ever been to a doctor's office, you've gotten a questionnaire before you see the doctor, right? There's a standard questionnaire that basically asks you, how many days a week do you drink? How many drinks, do you have per setting? And, tries to kind of determine if at baseline there's some level of concern. The problem with that questionnaire is people never answer it honestly. And with good reason, right? One, the test is rarely administered by the physician they know. It's usually by some member of the staff of the clinic. So it's very impersonal when it's administered. The other thing is people are always worried about the consequences of answering it, right? They're worried that they're going to be judged by their physician. They're worried that maybe something could show up in their permanent record that could affect their ability, maybe to get life insurance or whatever. So yes, people do not answer these honestly. I've definitely lied on this questionnaire in the past, and I don't blame people for feeling hesitant to respond to that because it's not all in your head. There's a huge stigma to substance abuse and, problems with addiction in medicine. I would say with mental health in general, the medical profession does a poor job of extending compassion, empathy, all that kind of thing. But when it comes to substance use, don't even get me started. That is very commonly seen by medical professionals as a moral failing, right? It's not a societal issue. It's not a genetic issue. It's you who has weak morals. So it's a tough question. It's a tough topic to discuss rather with patients. And what's so brilliant about this test is it opens the conversation. I generally draw this test on every patient when I first meet them. And when they go through the test, they'll see a number that comes back at them. And the number will either tell you, no, there's no drinking going on here, or it's so minimal that it's not consequential. Or it could tell you, yes, this person drinks, but they're a moderate drinker, less than 1 or 2 drinks a day, or, maybe 4 or 5 on the weekend, right? And then there's like the elevated numbers that tell us that either you drink excessively on most days or you hit it really hard, uh, you know, as like a weekend warrior, Friday, Saturday, Sunday, or Thursday, Friday, Saturday, or whatever it is. The nice thing about the test is it is very sensitive and very specific. So what that means, sensitive means if you're drinking, it will generally catch it, particularly if you're, a heavier drinker. And it's very specific, meaning if it's positive, it's not anything else. There's not many things that will cause that test to pop positive. There are some things that medical conditions that may give you a false negative, but not so much a false positive. So I think it's very eye-opening for patients, and patients who have previously kind of dismissed drinking as potentially a problem will see that number and it hits home. And oftentimes that's all that's needed. Very many people can see that number and they will modify their behavior on their own. And they're looking forward to redoing the test because they want to come back to their doctor with a gold star. And I love this part, I also have clients tell me that they speak to other clients and they kind of gamify it. Like, hey man, what was your PET score? Oh man, mine was 120. Oh dude, mine was 350. And when they see that disparity, they kind of want to all be in a healthier range of drinking. And then, for some people, there are people who just really deeply have a problem, but have been hiding it. And that opens the conversation to more, in-depth treatment of the issue. But I think it's a brilliant test. I cannot believe it's not part of the guidelines for screening. As we all know from COVID, drinking is a huge problem in our society. It's one of those things that's sort of expected of people. It's how we celebrate every get together, every vacation. And it's one of those things that if you struggle with alcohol, it's really hard because, again, every birthday, every Christmas, every Thanksgiving, people ask you why you're cutting back on your drinking or you're not drinking. That it's one of those things that's almost against our culture. But the one thing we don't talk about is alcohol is like one of the, if not the most deadly drugs in the world. I often tell patients like alcohol is more dangerous than heroin, and that blows their mind. But thought experiment, if you had heroin that was pure, meaning you weren't getting off the streets and, you didn't risk overdose, you didn't risk infection, but if you were just getting it from, a pharmacy, you could take heroin every day for the rest of your life and you could quit at some point. And really the long-term damage done by taking, a narcotic like that is trivial compared to the long-term damage that occurs with chronic alcohol use. Chronic alcohol use, obviously, as we know, causes liver failure. It also causes heart failure. It also causes a number of different types of cancer. So when people are coming to me and they're trying to maximize their longevity, oftentimes, they're looking to get, better insight from advanced data, or they're looking to get marginal gains by using newer emerging therapies that are less proven, things like rapamycin and peptides. But to be quite honest, many people would get way more bang for their buck just by being aware of their drinking and moderating it. So I hope this brings some awareness to this really easy to order, really cheap, really important and actionable test. I hope you found this interesting and informative. I hope you ask your doctor about this test. And share this with your friends. That's all I have for you today. I hope you found this informative, and I hope you have a great rest of your day.
Thanks for tuning in to another episode of the After Hours Clinic podcast. Make sure to subscribe to the show on your favorite podcast platform so you never miss an episode. And if you love the show, leave us a review. You can sign up for our newsletter at joinbetterlife.com. And feel free to send in your hot takes and medical questions to podcast@joinbetterlife.com. Disclaimer: this podcast is for informational purposes only and does not constitute medical advice or establish a doctor-patient relationship. Content should not replace professional medical consultation. Always consult your healthcare provider for medical conditions. Do not disregard or delay seeking professional advice based on podcast content.